Hello everyone at Inner Wheel. My name's Susie Miller and I work at the Ritchie Centre. The Ritchie Centre is Australia's largest perinatal research centre, and we concentrate on the health of mothers and babies and making sure that our smallest babies have the healthiest start to life that they can possibly have. The Ritchie Centre is a joint centre within the Hudson Research Institute and also Monash University. It was actually 10 years ago that I received my first research grant from the Inner Wheel Foundation, and I'm incredibly grateful for that funding. I pulled up this letter that I received actually 10 years ago for that first research grant that I submitted as CIA. It was signed by Margaret Whitchurch, who I think was your president at the time. It's a really nice reminder of the collaboration and the work that we've done together over the last 10 years. Previous to that, we had been fortunate enough to work with you and Professor Graham Jenkin, who you may remember. And down the track, now here we are in 2023. I'm lucky enough to be the head of the Ritchie Centre, and I can now look back on that 10 years of working collaboratively with the Inner Wheel and express our immense gratitude for the contribution and the collaboration that we've had together over the last 10 years. Preterm brain injury is a very important problem, and it's a big problem. Preterm birth affects almost 10% of babies in Australia, which means 1 in 10 babies will be born preterm. In every Australian classroom, there are 2 or 3 children that need some form of aid or assistance in the classroom. And while there hasn't been a direct link made between those babies and whether or not they're born preterm, these are the children that are likely to go on to suffer cognitive, motor and behavioural deficits. So around about 50% of children who were born very preterm could do with some form of neuroprotective therapy. We want something that targets the specific mechanisms of injury, and we now know that this is an inflammation-induced injury. We want something that will be safe, we want something that will be efficacious. And what we've shown over the last 10 years is that umbilical cord blood stem cells are exactly this therapy. Back in 2013, we funded one of our PhD students, whose name was Jingang Li, and he was looking at whether umbilical cord blood stem cells had neuroprotective properties for the very young brain. That is, the brain of the preterm infant, and we know that preterm infants have a very high likelihood of brain injury and then long-term deficits. He used an animal model, a sheep model, of preterm brain injury. And in that work, Jingang was able to show that when we gave umbilical cord blood stem cells, we were able to reduce brain inflammation in its very earliest form. And we showed remarkably, and the first ever evidence, that umbilical cord blood stem cells were very anti-inflammatory. This was the first time we'd done this, and we were really excited by the results. Jingang then went on to show that we could reduce cell death within the preterm brain as well. So again, the very first evidence that umbilical cord blood stem cells were able to prevent the progression of cell death within the white matter of the preterm brain. Now, these two insights and findings together were the first of their kind, and actually led us to get a very large grant from the NHMRC to study this in great depth. This really meant that the funding that we got from Inner Wheel back in 2013 was the precursor to a very large research project that we've been able to undertake to look at whether or not umbilical cord blood stem cells are protective for the brain, how they do this, and as you'll find out over the course of the next 10 minutes or so, we've now taken these very early preclinical findings right through to a clinical trial.
In 2016, we got given a grant to further study umbilical cord blood for brain injury. We had all of the basic knowledge that we knew that cord blood was effective and could actually reduce brain injury, But the next step was we had to work out how it did it and what those mechanisms were. And so what we decided to do was, cord blood is made up of lots of different cells. So our first project was to isolate all of those different cells and actually work out, are there particular cells in cord blood that was really effective in causing the reduction in brain injury? And we actually found that while the different cells did have different effects and they were beneficial, it was the combination of all of the cells in cord blood that was actually the most effective. And so over the next few years of our research, we actually progressed to then test all of the things that were going to lead us to a clinical trial. So in order to progress our work to clinical trial, we needed to answer some of those really basic questions so we could design the best clinical trial that would benefit babies when we finally gave them cord blood cells. In order to work with clinicians, we wanted to inform them on what was the best time to give the cells. And so what we found out was the earlier and the closest to the injury was going to be the most effective to reduce and prevent brain injury. We also found that giving cells intravenously was really effective. So with our clinical colleagues, we now knew what the best dose was, and as the closest to when they were able to diagnose the injury, and giving the cells easily in an intravenous form was going to be the best way to give cord blood to our preterm babies to help improve their brain injury. Cerebral palsy is actually caused by a lot of different injuries that can occur during pregnancy or in that critical period after birth. And one of the excellent outcomes that we've had from our research is we have been able to apply cord blood to lots of these different conditions, and the encouraging results are that in all of the conditions we have tested, so this includes inflammation-induced injury, if you have an infection during pregnancy, it could be if you've had a traumatic birth and the baby has experienced birth asphyxia. And it can also be if a baby has just been born preterm before those organs are ready to function and for the baby to survive outside of the womb that early. Cord blood has been effective in all of these instances. And so it's been really important that we can take this knowledge to the clinicians that we're working with, and they can now apply cord blood to lots of different indications that we know can result in cerebral palsy. This is Dr. Taylor Penny, one of our postdoctoral research scientists, and she has also benefited recently from inner wheel funding, where we're now taking our cord blood research and we're looking into new avenues where we can expand these cells as a new potential therapy to use for preterm babies that we can't give their own umbilical cord blood to. And so this is a really new and exciting area that we're hopefully going to be able to have some very promising results in the future.
So here at Monash Children's Hospital, we look after approximately 100 babies a year born at less than 28 weeks. So these are the most premature, tiniest babies that we see anywhere in the country, and they're born here and then cared for in the NICU by doctors and nurses such as myself. Now, while we've got better over the last many years at improving survival rates for these babies, unfortunately the rates of complications from prematurity continue to be high. So every day when I see these tiny babies born at 23, 24, 25 weeks, so very premature, they will often survive, but longer term we see the problems related to prematurity. And this in particular relates to brain injury. So that can lead to things like cerebral palsy or long-term disabilities. And at the moment, we don't have any cures or treatments for these injuries. The longer-term outcomes have not really improved over the last couple of decades. So we're really interested to find new types of treatments that may be able to help with this problem. At the Ritchie Centre, with the help of Inner Wheel, is trying to look at if we can use cord blood as a possible treatment for the problems that infants develop because of prematurity. We've been able to translate the cord blood scientific work that's been happening in the lab and bring it over into the clinic in a world-first clinical trial of cord blood stem cells for babies born at less than 28 weeks. And my role in this study has been to enrol babies who are born very early, and we have been collecting cord blood when they're born at less than 28 weeks and then actually giving babies their own stem cells back as an IV infusion. And this is really exciting because this is potentially a world first new treatment that might be able to reduce the rates of disability for extremely premature babies. The laboratory at the Ritchie Centre and my colleagues there have been looking at all these 3 different types of reasons why babies get preterm brain injury, and all of those things combined then lead to disability in the future. So that might be things like cerebral palsy, it might be cognitive impairment, learning difficulty, behavioural problems. Or we know that all babies who experience preterm brain injury have a higher risk of these long-term problems, and that can go all the way into school age and adulthood. So we're hopeful that if we can investigate cord blood stem cells as a possible treatment, we might be able to reduce the rates of these complications for those who survive being born so early. What you've allowed us to do is really investigate, for the first time in the world, a possible new treatment for the most fragile and premature babies. And we've been able to move the work from the lab across into the NICU already, and we're really hopeful that this will be able to show long-term benefit from babies, not just here at Monash, but across the neonatal community.
We are particularly interested in looking at fetal growth restriction, and we know that this is a common pregnancy complication in around 9% of pregnancies in Australia each year, where the fetus fails to reach its genetically determined growth potential, so they're born smaller than they're supposed to be, and this has a wide range of deficits associated with this condition. Sadly, there's no cure for fetal growth restriction, so we're looking at administering different treatments to kind of improve outcomes for children born growth restricted. We have a lamb model of fetal growth restriction that we use to kind of replicate what we see in the clinic with babies born growth restricted and see if we can improve the outcomes for them using this lamb model. We put our lambs in mazes to assess their learning and cognition, and we see that with fetal growth restriction this is impaired, and we see poor performance in these maze tasks, indicating they have altered behaviours and reduced learning and memory capabilities. In our pilot study, we have some really exciting data where we have got a preclinical model of fetal growth restriction, our lamb model, and we have taken a cohort of these lambs and given them umbilical cord blood stem cells. So we have done this after they are born to hopefully improve their brain connectivity that we see impacted with fetal growth restriction, and we hope that this will be then an appropriate treatment for this condition. Excitingly, in our results we have seen that the lambs have improved behaviour and improved outcomes in the maze tasks, and we hope to delve into this further and see what is happening in their brain pathology and see if that is also improving with this umbilical cord blood stem cell treatment. So we hope that then this treatment can go into further preclinical studies and then hopefully into a clinical translation, so babies born growth restricted could receive this umbilical cord blood stem cell treatment and then hopefully improve their outcomes in different sorts of neurodevelopmental conditions, and the impacts of growth restriction would be reduced on this cohort of children.
With previous funding from the Inner Wheel Foundation, we've shown that fetal growth restriction, or FGR, increases brain inflammation. And through funding through Inner Wheel, we've shown that administration of umbilical cord blood cells can reduce inflammation in FGR neonates, and this is correlated with improved brain pathology. As Tegan described, we see quite significant changes in the brain pathology of FGR neonates in our preclinical model. Tegan's also shown improved function of these FGR lambs after birth. So the next phase, which we hope to progress in the coming 6 to 12 months through funding, is to really investigate the mechanisms of actions of umbilical cord blood cells on brain pathology and its relationship to brain function, which is currently unknown. In the next phases of this research, we hope to perform in vitro experiments, or experiments in a dish, where we look at different brain cell types within the brain, not only the neurons but also the oligodendrocytes as well as the microglia. Our aim is to look at the ability of umbilical cord blood stem cells to improve the proliferation and morphology of these different cell types under similar conditions to what the brain would be exposed to in the setting of fetal growth restriction. We hope that these experiments will provide evidence-based recommendations for future therapies for FGR infants born in the neonatal unit. In Tegan's previous studies, we've shown significant improvements in the function of the FGR lambs after administration of umbilical cord blood stem cells. The next steps include optimising the dose and the timing of administration of umbilical cord blood stem cells to really understand how we can better improve brain function and pathology of FGR neonates.
I hope that you've enjoyed listening to those little tasters and teasers of all the things that we've got going on in the lab and have for the last 10 years. We have a fabulous bunch of researchers and they're all working really hard to make sure that the money that you raise is going to exactly what you want, and that is to improve the lives of babies that are born preterm or with fetal growth restriction. Thanks so much for your support.